Dr. Darren Clair, and you're watching Vibrance. As medical director of Vibrance, I constantly get questions from men and women about whether or not they are candidates for bioidentical hormones. Well, now that Oprah has come out in favor of the hormones, I think that the general community has accepted the fact that it is something that's legitimate and that should be looked into. I wholeheartedly agree with Oprah that hormones are an important and essential part of living a happy, healthy, and vibrant life. As we've been doing for the last 10 years here at Vibrance, we look at women's hormone levels based on their symptoms that they may be having, whether it's premenstrual tension, bloating, migraine headaches, fatigue, depression. A lot of the symptoms that they would normally receive a pill from their doctor for. We analyze their hormone levels because I found through many years of research and experience that often, even in their 30s, a woman's hormone levels will begin to get out of sync. And that gives rise to a lot of symptoms that are troubling to women, therefore treated by their physician with a pill, whether it be an antidepressant, a Midol for migraine headaches, whatever it is. The doctors are often not getting to the root cause of the problem, and that's what we do here at Vibrance. We look at the hormone levels, which very often aren't the root cause, and we treat the root cause. We supplement with natural bioidentical hormones, and by doing so, we give great relief to the woman, and we help her restore that vitality and vigor and joy and happiness in her life that she often has been missing. Perhaps a few examples would be helpful. One typical patient that I see, and I've seen 100 if I've seen one, is a woman who comes to me saying that, doctor, I've been trying so hard to lose these last 5 pounds. I eat like a bird, and when they tell me what they eat, they truly do eat like a bird. I've been working out, an hour every day with a trainer. This is Beverly Hills, so that's a very common thing here, and women are very concerned about how they look here. And they're tortured by this, and sometimes it's more than 5 pounds, but nonetheless, they are struggling. They go to their doctor because they believe it's their thyroid that's underactive. The doctor does a typical screening test, and because the screening test is in the normal range, he or she concludes that the thyroid is fine. It's tough to take for a woman who's already trying awfully hard to lose some weight. What I have found is that we can't just rely on the blood test results. We have to remember that those blood test ranges are for all comers. It only excludes a small proportion of the general population. So a person can be within the normal range in terms of their blood test results, and yet they may not have enough hormones for their own particular needs in order to feel and be as healthy as they can be and lose those few pounds. So if a woman comes to me and she clinically has symptoms of a thyroid issue, she's having trouble losing some weight, has dry skin and dry hairs and brittle nails, those types of symptoms. She's tired of waking up in the morning after getting 8 hours of sleep. If a woman tells me that story and I check her levels, and I do more than just a TSH, a screening test, I look at the actual thyroid hormone levels, and if they're not in the upper range of normal, I think it's perfectly acceptable to give that woman a trial of some thyroid hormone and see if it doesn't help increase her metabolism somewhat and help her lose those few pounds.